Bismillahirrahmanirrahim. In the name of Allah, who is the most beneficent and the most merciful. Today, we will discuss about the arteriosclerosis. Mainly, arteriosclerosis is the hardening of the arteries. There is an artery, and if there is a hardening and decrease oxygen supply to the other organ, that can lead to the other consequences. Number one, we will discussing about the arteriosclerosis affect mainly small arteries and the arterioles. It has two types. Number one is the hyaline arteriosclerosis and the hyperplastic. By the name, it is the hyaline, mainly deposition of the some protein in the vascular media. Other is the hyperplastic. Hyperplastic, in this case, there is a mainly multiple of the division of the vascular media. Now we are discussing about the hyaline. What is the hyaline arteriosclerosis? Is mainly caused by the protein leaking into the vessel's wall produces vascular thickening. Mainly consequences are the long-standing benign hypertension or the diabetes. It can cause ischemia, glomerular scarring that may lead to the chronic renal failure. That we all discuss about the arteriosclerosis, mainly the hyaline arteriosclerosis due to some protein, the most important. This is the other is the hyperplastic arteriosclerosis. It involves the thickening of the vessel wall by the hyperplasia of the smooth muscles in the vascular media. Hyperplasia of the smooth muscles. This is the arteriosclerosis. This is the breast mammography, and here it is the microscopic feature. This is the some protein leaking into the that of the area of the vascular media. This is called as the hyaline arteriosclerosis. We have discussed two types. Number one is the hyaline arteriosclerosis, and other is the hyperplastic arteriosclerosis. Now we are discussing about the Monckeberg medial sclerosis. What is the Monckeberg? Because it is the calcification of the media of the vascular wall. Medium-sized arteries affecting the medium-sized arteries and mainly involves the calcification. Person older than the 50 are commonly affected. Calcification do not encroach the vessels. Human are usually not clinically significant. Here this is the calcification of the vascular media. The most important, if we are discussing about the arteriosclerosis, hardening of the arteries. Now, what is the atherosclerosis? Athero mean there is atheroma formation. What is the atheroma? It is the three layers. Number one is the intima, if case of the media, and the vascular layer. If there is some changes in the intimal layer and hardening due to some deposition of the fibrin, some deposition of the cholesterol, and some deposition of the latent macrophages. Atheroma formation. Its pathogenesis we will discuss about the some type of the coronary artery, cerebral, and the peripheral vascular disease. Intimal plaque, because intima involved always. If there is a lipid accumulation, here it is a lipid accumulation, from that point only intimal layer involved and there is no blood flow. That's why this is the atheroma formation. We are discuss its pathology later on. The most important arteries are affected are the abdominal aorta, coronary artery, popliteal artery, and internal carotid artery. That's the most important. This is the mainly intimal layer. This is the layer of the intima, and this is a vascular media. In between the intima and the media, there is two things you should understand. One is the fibrous cap, other is the necrotic center. Fibrous cap mainly consists of these are the smooth muscles, macrophages, foam cells, lymphocyte, collagen, and the neovascularization. Other is the necrotic area. This is the necrotic area, and mainly these are the, you should remember the three C's. Three C's. Number one is the cell debris. Number second is the cholesterol crystal, and other is the calcium and the foam cells. Foam cells are mainly present in the fibrous gap and the necrotic center. If you are discussing, the most important is the fibrous gap, and that is the necrotic center. You may understand the 3 C's. Risk factor may be modifiable. You can change your diet, your activity, other causes. Modifiable and the non-modifiable. Number one is the hyperlipidemia. You can control the hypertension, smoke, you can cessation of the smoking, and the diabetes and the inflammation. Other is the non-modifiable, which are not our control. This is the genetic abnormalities, family history, increasing age, and the male gender. This is the most important, fibrous gap and the necrotic center. Now the most important, we are discussing about the pathogenesis. Pathogenesis. Number one is the damage to the endothelial. Here, this is the damage of the, I want to be show with you that of the, this is the endothelial layer. This is here, I want to show by the, this is taken from the Robin book. This is the endothelium. This layer is that of the endothelium. In case of the response to injury, there is some changes in the endothelium due to hyperlipidemia, hypertension, smoking. Due to these causes, there is an endothelial injury. Here, this is an endothelial injury, and the monocytes are involving here, and the platelets are moving towards the vascular media. This is the endothelial dysfunction. Number one is the endothelial dysfunction, and monocytes coming here towards that area. This is a leukocyte adhesion and the immigration. Other is the macrophages activation. Smooth muscle recruitment is the here. If there is some changes in that area, always smooth muscles also come here. In this case, smooth muscles come, and some deposition of the smooth muscles area. And number third is the macrophages and smooth muscle. Mainly after this, there is a fatty streak formation, the most important fatty streak. If you, because I want to be discussed with you, the fatty streak always formation from the 1 year of the age. If a patient, every person has its fatty streak from the 1 year and up till to the death. In case if we do not change our modification, it can increase towards the up to the old age and can lead to the atherosclerosis. This is a fatty streak, the most important. There is a T lymphocyte and the fibrofatty atheroma formation. Here, this is the atheroma formation. There is a lipid debris. It is a two. This is the fibrous gap and the necrotic debris. This is the most important. What are the complications? I will be discussed with you is the what are the complications. If there is a not blood flow towards the other area, and that can lead to the stenosis of the medium cells, can lead to the peripheral vascular disease, angina, ischemic bowel diseases, that can lead to the stroke. If it blocks the middle cerebral artery, the most important is the stroke is the middle cerebral artery. You may remember, in case of the myocardial infarction, this is a coronary artery. Two things in the medical you may remember: the coronary artery is the myocardial infarction, and the stroke is the middle cerebral artery, the most important. And this is a plaque rupture with the embolization result in the atherosclerosis. If there is a rupture, the most important, if we discuss, if there is a formation of the atheroma, but it can dislodge and can lead to the other area. Plaque rupture lead to the embolization, emboli formation. And the other is the abdominal aortic aneurysm. This is the mainly I want to be discussed with you from that diagram. This is the normal artery. This is a fatty streak, and this is the fibrofatty plaque and advance in the stage of that area. Here, in case of the clinical phase, this is a preclinical phase, usually young age. In case of the young age, it is increasing up to, but after advanced vulnerable plaque, that can lead to the aneurysm and some rupture or collision by thrombosis, critical stenosis. This is happening in the preclinical phase. It is mainly happening in the from the birth to the death area that we all discussed. We have discussed about the arteriosclerosis and the atherosclerosis, the most important. And thank you so much. Jazakallah. Allah Hafiz. Please like and subscribe our channel Medicos Fever, and remember us in your prayers. Allah Hafiz.